A very good evening, everyone. I'm Dr. Surabhi Mitra, a psychiatrist and your moderator and host for tonight. Today's show has been brought to you by Evrox Healthcare, which is a digital healthcare company, and its flagship product is the F1 app, which is being launched soon. For which we are recruiting all sorts of doctors, medical professionals, mental health professionals, nutritionists, etc., etc. So whosoever is interested, please do contact us with the phone number given on the poster for the demo of the app. Now, today's program is about safe motherhood, some Coke Studio production. Now, what is safe motherhood? It means ensuring that all women have access to the information and services they need to go safely through pregnancy and childbirth. It includes education on safe motherhood, prenatal care, counseling, and other focus on the high risk pregnancies. Promotion of maternal nutrition is also included. The goal of the National Safe Motherhood program this time was to reduce maternal and neonatal morbidity and mortality and to improve the maternal and neonatal health through preventive and promotive activities as well as by addressing avoidable factors that cause death during pregnancy, childbirth, and postpartum period. So we recently had the National Safe Motherhood program, and today, for discussing this, we have invited two very intellectual people. One is a gynecologist and obstetrician. She is the executive director at Omega Hospitals Nagpur, and at present, she is also the president of JCI Medicos Nagpur 2022. Please welcome Dr. Parul Saoji.
Hi, Surabhi. Thank you for inviting me over.
Hello, Dr. Parul, and thank you for accepting my invitation. The second speaker
Absolutely, my
that we
pleasure.
have, oh, thank you. The second speaker that we have was my teacher during UG and PG days. She is a pediatrician and she's the professor of pediatrics at NKP Salve Institute of Medical Sciences, Nagpur. Please welcome Dr. Anjali Edbor.
Hi, Surbi. Very glad to be live on this show with you for such a noble cause of safe motherhood.
Thank you, ma'am. Thank you. So I think we should start with Dr. Parul, her being a gynecologist and obstetrician. So, Dr. Parul, I think we should go step by step. So, if we start with the preconception period, so what advice would you give to be mothers who are planning for conception?
See, it's very important, especially in today's era when we are talking about preconceptional planning and all. We firstly should treat motherhood as a profession also. So, the first advice which I would like to give as a gynecologist, seeing the present scene and scenario, that people should really plan on their pregnancies before they enter their late 30s. At least, when they are in the age bracket of 28, 29, they should definitely start planning to plan a pregnancy at least. That is my first advice. Second of all, once you get into that mode that yes, you do want to plan, so that few supplements like folic acid should be taken care of, should be included in your diet. And external supplements should also be taken so that eventually the baby wouldn't have any neural tube defect. So, what is important is the right age. So, that's my advice as a gynecologist and an infertility specialist, that people should really start on planning pregnancy earlier. It shouldn't be like how it used to be earlier, that shadi hui to 3-4 saal, we'll give it a break, we'll get to know each other. My advice is plan pregnancy earlier. Second, start getting folic acid supplements in your pregnancy. Start experiencing and practicing a healthy routine, which includes that you should be doing at least 15 to 20 minutes of exercise every day, which could be in the means of a brisk walk or yoga or whatever mode of exercise suits you, or whatever you please to do, be it zumba, be it yoga, whatever you would want to do. And lastly, I would like to say that healthy sleeping pattern is also very important when it comes to the hypothalamic pituitary axis. So all these things together would be contributing in a healthy preconceptional period So I think these things should be taken care of, Siddhi.
Okay, ma'am. And what advice would you give to be mothers who are actually not having such a lifestyle and who have hectic job schedules, whose sleep cycle is absolutely disturbed, whose food cycle, meal cycle is disturbed. At the same time, they may be also consuming alcohol or smoking. So, what would your advice to for them be during the preconceptional period? Because as we know, in pregnancy, it is absolutely not allowed. But what in the preconception?
See, in preconceptional period, we usually say that 3 months prior to whenever you are planning pregnancy, you should stop consumption of alcohol, smoking, or any amount of nicotine in any form should not be consumed. So that is one part of it. Second of all, considering the fact that many of the women are working for IT companies or these multinational companies, so their sleep pattern or their eating pattern might be not what is expected of a healthy routine. So what can be done is that they can probably request on to their managers that if they can have the regular sleep patterns and those shifts. If not possible, then they should make sure that at least 6 hours they should be going off to bed for at least 6 hours in a duration. And other than that, they should make sure that they consume a lot of antioxidants in their diet. Not always everything would be possible, so they can have some berries with them when they are going to their offices. They can have nuts with them, which can contribute to providing them with antioxidants. And other than that, proteins should be taken care of. You should consume a lot of proteins in your diet, which could be basically white of egg or badam. It's something very simple that you can just soak 4 badams and just consume it on the go. So all these protein bars, you can just have these quick easy to go things for the women who are working and who are having a nuclear kind of family, where it wouldn't be very much possible for them to arrange for all the other things. So I think this should be taken care of, that on the go meals which are rich in protein and should be consumed. So all these things should be taken care of.
Right, right. So, Dr. Anjali, now that we have started with the process of conception and then we will be going towards pregnancy, but I'm sure that a lot of people visit a pediatrician as well during preconception and when they're planning a baby and when they also get pregnant. So, what advice do you give them during that period to maintain the
See,
health, to maintain a healthy fetus? Yeah.
yeah. So, as very rightly said by Dr. Parul, that sleep, alcohol, substance abuse, all these things need to be cut down, and very important is the folic acid, which needs to be consumed very well. But as a pediatrician, what I would like to suggest them is that I would like to prevent the baby from TOSH group of infections. So I would obviously ask for their vaccination status, mainly regarding MMR. If they haven't received MMR, so then they can take MMR, but then they have to postpone their planning for 6 months, because this is a live vaccine, and it will prevent the baby from getting rubella, from getting adverse effects of mumps and measles if the mother suffers mumps and measles in the first trimester of pregnancy. So it's very important, like even the government has floated the MR campaign, where they are vaccinating all adolescent girls up to the age of 15. But then still some of them are not aware, and they get missed for the MR vaccination, that is the measles and rubella vaccine. So this history needs to be asked whenever they are planning for conception. And if not anything, at least rubella vaccine has to be taken prior to pregnancy, at least 6 months prior to pregnancy, so that a very disastrous thing which is called as congenital rubella syndrome can be avoided, can be prevented totally in the newborn if the mother is vaccinated against rubella. The other thing which I would like to highlight is regarding the chromosomal and the genetic disorders which do happen during the first trimester of life, when there is organogenesis going on, and all those chromosomal disturbances going on. So they need to know, I need to know the family history also, and the age of the patient. Nowadays, the couples are dealing pregnancy beyond 30, beyond 35, and all those things. So I would advise them not to go that late in their pregnancy, because chromosomal disorders somewhere the incidence multiplies after the age of 30, and furthermore after the age of 35. So it's better to complete their obstetric career before the age of 35. That is what I would advise. And like we see nowadays, postponing pregnancy using so much of contraception somewhere has increased the incidence of infertility. And then going in for various measures to conceive, and so many drugs to be consumed, and all those things might somewhere affect the health of the baby in utero. So all this thing needs to be cautioned for the couple who is planning for pregnancy. That is my advice.
Correct,
Surabhi, I would
correct.
just like to add, Anjali ma'am has
Please.
really very beautifully elaborated, all those things. I would just like to add that your one history, which is very important, is consanguineous marriage, which, should be taken care of, whether they are married to, in the family, that's
Yeah,
one thing.
within
And
relatives.
yes. And one more thing that which we, as a practicing gynecologist, which I am seeing is that here in Vidarbha, especially in the Sindhi community, we are seeing that HB electrophoresis is also very important, which is to rule out any hemoglobinopathy like sickle cell disease or beta thalassemia, because these things are very much prevalent in this part. So I think that one test is also very important. We have started, in fact, counseling for all the girls who are coming pre-marriage to us for something or the other,
Yeah,
like irregular periods or something. So we said that rather than, kundli dikhane ki bajaye, you get these few tests done. People have this misconception that blood group is something which they need to, see for their counterparts or something. Rather, we say that HB electrophoresis and family history is very important, if at all, something significant is there. So that should be
exactly.
definitely, considered, and should be considered when a person is planning to getting on married, and if at all married, then I think these tests should be done, so that we know what is the status, and eventually the fetus would be having any of these abnormalities or not.
Yeah.
Even a lot of
So that is
times as
pre-marital
psychiatrists,
counseling.
yeah. So even a lot of times as a psychiatrist, we actually tell our patients, to also get their mental health checkup done before,
Very
finding,
important.
very important. And secondly, because, even diseases like schizophrenia, bipolar, they are mostly genetic. So yeah, even if one a parent has it, there are 10% chances that the child may contract it. And if both the parents have it, then there are 50% chances that the child will have it. So yeah, that is number one. Also, we ask them to get tested for STIs, STDs, and HIV, because that is one thing people don't tend to do.
Urology, yes.
Yeah.
I think
So
that's a
that,
part of first trimester testings. Once you come to know that you are pregnant,
Yes,
all these things are a part
yes,
of it. And nowadays, even electrophoresis has become a part of
yes. It
natal
is a
and prenatal,
mandatory.
yeah, antenatal
Yes.
testings and everything.
I was just adding to Dr. Parul's that dialogue, कि कुंडली दिखाने से पहले ये सारे tests
Yeah,
करा लिया करो एक दूसरे के.
surely, surely.
Yeah. So
Absolutely.
moving ahead, Dr. Parul, now we will go trimester wise, right? So what would your advice be to patients who are already pregnant in their first trimester for safe motherhood?
Yeah. So the first thing which I would say is that the moment you come to know that you are pregnant, as in if you do a urine pregnancy test, or many a times, like the public right now is becoming a lot literate. So if they get a beta HCG test done, which is a blood test, so any of the two things, what they need to do is that they need to visit a gynecologist for getting a first trimester scan. We also call that as a dating scan. It is very essential, so that we come to know that exactly what is the expected date of delivery, because in eventual scans when they would be done, we'll come to know if there is any IUGR, that is growth retardation in the baby, or any of the things which have to be calculated eventually have to be matched. If the expected date of delivery goes well with the the sonographic expected date of delivery goes well with the expected date of delivery by the last menstrual period. So first important thing is a dating scan, which they should get done. Second of all, they should definitely consult a dietitian to all what they can consume. Especially in the first trimester, they should be counseled that vomiting is normal. They shouldn't panic. But if the episodes of vomiting are more than 4 to 5 in a particular span of 4 to 5 hours, then definitely they should make sure of all the measures to keep themselves hydrated. They should get a few, array of tests done, battery of tests done. That is hemoglobin, like complete blood count. Other than that, blood group, which is very important, because if the mother is negative, not in the first pregnancy, but in eventual pregnancies, yes, if the negative blood group of the mother is there, it would be affecting the eventual pregnancies. So that is important. Then a thyroid profile, it's important. Serology, as we've already discussed, HIV, HbSAg, HCV, VDRL, blood sugar levels, and yes, HB electrophoresis. These are the battery of tests which we ask our patients to get done once they are diagnosed that they are pregnant. Other than that, we tell them that sleeping for 8 hours and 2 hours in the afternoon are compulsory for a woman to have a proper resting. We also counsel them that they will have an increase of urinary urge to go to the washroom because of the uterus increasing in size. So they should make sure of all those things. We will definitely give them advice on keeping a coital act. So that is normal, but they need to make sure of the fact that they use a barrier contraceptive whenever they're getting into something like a coital act. Other than that, I think we will be supplementing them with folic acid, some syrups or something for multivitamins, and uh, antiemetics, so that they do not, have too much of hyperemesis in the first trimester. So the dating scan is really important. And other than that, once they finish with that trimester thing, the third month, that is the NT scan, which nowadays is becoming a must for most of the patients, because the age group, as ma'am has also mentioned, that they are delaying the age of conception. So the nuchal thickness is very important. So that third trimester scan, the third month scan is very important, and along with that, double marker test, which we get done for our patients. So I think these things are to be taken care of. And other than that, we are actually counseling our patients to do a little bit of routine exercises or a walk. And garb sanskar is one thing which is actually taking up a lot, and it really helps patient connect with their baby inside their womb, and help them meditate, and help in a healthy pregnancy.
ऑल राइट. गर्भ संस्कार वाला क्वेश्चन आई एम श्योर कोई ना कोई तो पूछने ही वाला था ऑडियंस में से, तो शायद वो आने ही वाला है आगे चल के. बट या मे बी वी कुड एलैबोरेट ऑन इट लेटर. So Dr. Anjali, would you like to add your advices to this?
I think
Like during
only
pregnancy
one
wale
thing
advices.
which
Yeah.
only one thing which I would like to add to it is, though that is done a bit late, but the anomaly scan which is done before 20 weeks can be done at the end of 3 months. That is during the end of first trimester and the beginning of the second trimester. Because most of the congenital anomalies like the neural tube defects, the hydrocephalus, and the things anencephaly, which are not compatible with life or which are going to give rise to a very bad quality of life further for the patient as well as for the parents, which though speaking would sound very harsh, but then really it becomes like a burden rearing up those children. So the what to say, decision regarding termination of pregnancy can be taken up easily, though not that easily, but yes, early decision can be taken up, because up to 20 weeks we say that medical termination of pregnancy is safe. But if done as early as 3 months, that is 12 weeks to 16 weeks, would be much easier. Also for both gynecological obstetrician as well as the parents to come to a wavelength where they accept that yes, this baby was probably not meant to be born, and they can get away with the emotional setback which they have when later on either they come to know about these congenital anomalies, and then it is difficult for termination of pregnancy, where they have to rear up the child, where they have to come up with this child. So anomaly scan, which is now dated at around 20 weeks of gestation, if it is done at the bridge of first and second trimester, I think that would be a better choice. I think rest all Parul has really well explained everything regarding the first trimester. I would just like to add few drugs which might harm the organogenesis, like Surbi said, ki mental problems. Yes, so certain drugs which are taken up, like chronic drugs which are taken up for mental problems, for asthma, for other diseases like SLE, steroids, and all, which are taken up for long term, they need to be revised to safe limits during the first trimester, and if possible, they need to be stopped during the first trimester till the organogenesis is complete.
That is exactly what, ma'am, I was saying, that we are doing NT scan at third month, as in
Yeah,
12
you
weeks.
just spoke of NT scan, which will rule out the Down syndrome.
Ma'am, in that basically we are gonna be doing, because the complete anomaly scan is not possible. Early anomaly scan also we are doing at 16 weeks of gestation, for that matter. And a double marker along with an NT scan would definitely help us to rule out any
Yeah,
neurological deficit, if at all there
yeah,
is.
yeah,
Like you have mentioned about anencephaly and all those things, that can be actually diagnosed. It's a very wonderful point, because we also make sure that if it is 12 weeks, so it is easy for us, we can do it in one step, the termination can be
yeah.
done in one step.
Exactly.
But eventually
It's less
and
traumatic. It's less traumatic
yes,
physically as well as emotionally. Both way, it is less traumatic.
absolutely, ma'am. And just to add on to that, the limit has been increased by the government to 24 weeks, which is actually a boon to all of us, because many of the defects, especially the congenital heart defects, the fetal echo, and all those things can be done better and diagnosed better at 22 to 24 weeks. So I think that is a boon which has been added to us for by the government of India, that the termination limit has been taken up till 24 weeks. So I think yes, still in the first trimester these things are very important, and with the advent of double marker tests and quadruple marker tests, it just helps us to add on to the sonographic images, and if at all a termination is warranted, that can be done in one step.
Right. So now that we also talked about the first trimester and in between the first and second trimester, I think we should go ahead and talk about. Ma'am, you are muted. You are muted. You need to unmute yourself. Anjali, ma'am. Okay,
I
I
guess
will
Surbi,
unmute you. I
she
will
cannot
unmute
hear
you.
you.
Can't unmute. Okay. Can you hear me?
I guess she's just texted in the text box that, the chat box, that she cannot be hearing us.
Okay. 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 I think, yeah, she'll be removed and then she'll be again taken in.
Yeah.
Now, can you hear us? No. Okay. I'll just type it here. Till that time, I think we should continue with the second and third trimesters, and what are the milestones to be looked out for during pregnancy. The mother's milestones as well as the child's milestones, the fetus's milestones, I mean.
Yeah. So actually, we have a very beautiful checklist, which I think most of the gynecologists are doing. That there is first thing which we say is registration of the ANC, that is antenatal patient for us. So a ANC card is made once the fetal heart is confirmed. That is in the first trimester. The battery of tests, which I've already mentioned to you, they are done. And then when the patient comes in the second trimester, so we give them, especially for the patients who have a history of preterm labor or something, we call them at 16 weeks, so that we can see the cervical length also, so that if at all an os tightening, that is a cervical stitch, if at all is to be given, we can do that. for the patients who have history of preterm labor or in which there has been a repeated pregnancy loss. So the cervical length can be taken care of. And at 18 to 19 weeks, we give an anomaly scan date. Here, every time we tell patient that the BP and weight is to be monitored, the weight gain in pregnancy should be around 2 kgs in every month. That is, broad spectrum, what we say. If a weight gain of more than 2 kgs is seen, or if we observe any pedal edema, so two things have to be taken care of. First, we will always tell them to measure the blood pressure, keep a blood pressure record. For the normal ANC patients, we give blood pressure records to be taken care of twice a week. And in patients who are at high risk, especially after 35, or people who show some kind of resistance in the uterine artery Dopplers, which we do on scans. So we would tell them to do blood pressure monitoring every day. And other than that, if there is pedal edema, which is swelling on the feet, if we see any of these things, so we tell them, first of all, measure the BP, keep a BP record, that is the blood pressure record. Secondly, they have to consume high protein diet, because many a times hypoproteinemia also results in these swellings on the feet. Third of all, a array of tests is to be done, which is indicative if there is any preeclampsia, that is raise of BP only during the pregnancy. And lastly, a blood sugar levels have to be done, because many a times the weight gain corresponds to a patient developing gestational diabetes, which is diabetes which is during the pregnancy. Around 22 to 24 weeks, again, we can get a gestational this test, glucose tolerance test, in which we can diagnose if at all there is intolerance to insulin, especially regarding to the pregnancy. So these things have to be taken care of. We see the weight gain, we see the blood pressure, we always monitor the head circumference, that is the head of the baby, the abdominal circumference of the baby, the femur length, that is indicative the thigh bone, uska length, because femur length is one thing which is not usually affected, that's the last thing to be affected. And the blood supply to the fetus through uterine arteries, matlab the arteries which supply to the uterus. And other than that, we see the blood supply to the umbilical artery, that is the cord which is supplying the blood to the baby. And in these things, we can diagnose if the blood supply to the baby is proper or not, the growth of the baby is proper or not, if there is any growth retardation, or if there is any anomaly which can be judged at 18 to 20 weeks. If we suspect any ecogenic shadow, or if there is any other thing which we see which is indicative of some anomaly, but it is a soft marker, one or two soft markers on sonography, we will not indicate them to get terminated. We would do a repeat scan at 23 weeks, and then only we'll be taking a decision for termination if at all warranted. So that is what I think should be the things which we need to take care of during sonography, during the physical checkups of the patient. And yes, whenever the patient walks in, we are obviously when we are doing scans for our patient, we are seeing the fetal heart rate, and we make sure that we have a synonymous screening of whatever we are seeing, that the patients can also see, so that they feel good, especially during the anomaly scans, because 3D scans are also done, so the patients can see the facial features, the nose, the lips, the baby moving, the hand movements. And I think that's a wonderful sight for the mother to watch the baby move inside her.
That's so true, actually. That's very true. Dr. Anjali, can you hear us now?
Yes, yes.
Yes, yes. So, would you like to add something to this? We were talking about milestones of the mother as well as the fetus during pregnancy and what all to watch out for.
I was a bit cut off in between. I don't know whether Parul has spoken about the vaccination part in the second trimester of pregnancy, where there has been a change now, that earlier it used to be only tetanus. Now it is TD. It is a capital T and a small d, and even a P attached to it, that is we called as acellular pertussis. So it is Tdap or Td at least minimum which should be taken during the second trimester of pregnancy. And this has come in the change has come because there have been studies which have detected that it is not only now neonatal tetanus which needs to be prevented, but the development of diphtheria, which for which we give the vaccination at 6 weeks, that is 1.5 months postnatally, the incidence has increased at an earlier age also. So we want to transmit the antibodies transplacentally to the newborn as early as possible in utero, only to protect the baby. In the same way, the incidence of pertussis also has increased in the the extremes of age, that is in the geriatric age group also, and even in the newborns also. So these babies who are protected at 6 weeks of age, we want them to be protected in utero itself. And that is why this change has come, where now instead of TT, what we give is either TD or we give TDAP. This is one thing. And the second thing which Dr. Parul has very nicely said about the movements of the baby, the nose, the fingers, the hands, and the lips and everything. Now, though the question still not has come up about Garbha Sanskar, but here I would like to highlight the importance of early sensory stimulation. Earlier, this early sensory stimulation used to be after the baby is born and when the baby is preterm and the baby is kept in NICU, or the baby has suffered from birth asphyxia or some insult during antenatal period or natal period, that is during the process of birth. But there have been n number of studies now which have proved that antenatally also all the 5 senses of the baby needs to be stimulated. And what are these 5 senses? Are the vision, the hearing, the touch, the taste, and the smell. So all these 5, so of which smell and taste can't be done intranatally, but yes, the vision, the hearing, and the touch, these 3 things can be done. And that is by the mother singing something, talking something very good to the baby when she's alone with the baby, or when she's surrounded with the family members. Then not giving any harsh environment, not giving any rough environment to the mother, because the baby in utero also senses the mother's emotion, the trauma, the emotional trauma which the mother has. And then the massaging the abdomen of the mother, the uterus of the mother, and talking to the baby in utero also has shown to uh, increase the intellectual quotient, that is the IQ of the baby, and has made them to reduce the incidence of the violent behavior which we are seeing in the adolescents nowadays. So a thing which is done when the mother is pregnant has a long-term effect in the adolescent age also, where it rationalizes the behavior of an adolescent if the mother is that close to the baby in utero. So this is the importance of Garbha Sanskar. This is the importance of old people saying that you need to listen to Bhagavad Gita, you need to recite few hymns, few shloks, all these things, so which gives a good environment to the baby in utero. And the mother also is calm and quiet emotionally. She's not stressed. And because this stress is transmitted to the baby, and that is how we can have a normal mental development and a high IQ for the baby to be born.
This
And
was
regarding the
very
diseases of pregnancy, one has to be on a lookout. Well, that is the job of the obstetrician who's taking care of you. But then, yes, IUGR, which is called as intrauterine growth restriction, where the growth of the baby, because of the diseases which the mother is having, because of pregnancy, needs to be controlled, so that the baby grows very nicely with adequately, so that after coming out the baby does not require a neonatal intensive care admission, and the baby can be roomed in early with the mother and begun with breastfeeding, thereby preventing many other complications in the baby. One more thing which I would like to talk about second trimester is that the obstetrician needs to really look into the counseling of preparation of breast for breastfeeding, whether there is inverted nipple, whether there is retracted nipple, and all those things need to be sorted out antenatally. So this has to begin in the second trimester, and the mother has to be explained and prepared regarding her breast, regarding her breast hygiene, and regarding breastfeeding. So the nature of her nipple, the nature of her breast, and the breastfeeding has to be counseled during the second trimester, on and off, till she delivers a baby.
Okay. All those points were really, really interesting. And especially, the emotional aspect that you covered. I think, I don't know whether there is much research into it,
No,
but
There
there has
is,
been many
there
studies
is.
nowadays. There are many studies nowadays which have proven that yes, there is a scientific reason to Garbha Sanskar, and
yeah,
every girl, every pregnant woman should undergo Garbha Sanskar.
That
yes.
is what, we are at Omega also. We have made it official, free for all the ANC patients who come down to us on every Sunday of the month, last Sunday of the month. We conduct this, Garbh Sanskar with the Mana Shakti Kendra Lonavla. And they specially come down all throughout this lockdown also. It was available for them on a virtual platform. And now again, because of the, restraints getting up, we have started this in the hospital. And I think it is really, really beneficial for all the mothers. I mean, we see that change in them. They're so calm, and the babies also. I mean, I don't know. We have to do that research also with the babies who are born. We should actually, practice with the
Follow
IQ
up.
and all these things.
Yeah.
Those studies should also be done. But definitely, we have seen tremendous changes in the mother, the, positivity around them. And also, when they are undergoing these Garbha Sanskar sessions, the counterpart, that is the husband or also the in-laws and the family, they also get
Mhm.
involved. So the environment around the mother changes a lot, so it really, really helps them out.
Yeah, I did get this input from a lot of couples who went for Garbha Sanskar. And I just
Just
think
a
that we
minute.
should do,
Again, I have
I mean,
lost my
you have come
audio. I
back
don't know
now.
what happens.
You have come back now. You can hear us now, right?
I need to re-enter the studio. I'll do that.
Yeah, okay. Okay, so I think we should also do a follow-up study till the adolescent age of the
Yes.
children, and psychiatry, obs, and pediatrics can actually collaborate on this.
Yes, yes, yes. I think it would be a wonderful study to take up, that,
Wonderful study.
how these kids are coming up and how their grooming and their, outlook to life has changed just because of, some few things which people might be doing during the Garbh Sanskar thing. So I think that would be a wonderful study to take up.
बस बस अभी बहुत अच्छा आइडिया मिल गया है अभी इसको करना पड़ेगा.
Three of us are there, a psychiatrist, a gynecologist, and a pediatrician. And I think we three can, just start getting done with this study, and we just start getting going.
Yeah. We'll do the follow-up till adolescence. Ma'am, we'll do it, okay? Done. Okay, so now that we have already finished with the pregnancy part, I think now we should talk about birth preparedness. Ma'am, you're muted. Muted. There is some problem.
Yeah, I think some connectivity issue with her.
Yeah. So we should now talk about birth preparedness. You know, how to handle labor, how to go through it, what to anticipate, and then till delivery.
Yes. So what is important is once they enter in the third trimester, we start, counseling them, and we start taking these sessions. On first thing is important that the sonographies which are done, whether a normal labor can be done for that patient or not. That is one part of it. What is the presentation of the baby? Whether the head is down or whether the feet are down or whether the baby is in transverse position. So considering all these facts and coming down to the conclusion that yes, this patient is fit for normal delivery, we should do this, that we should have these labor counseling sessions. So what we are doing is that we have a labor counselor with us. So what she does is that around 34 weeks, she starts, giving them those sessions. She starts making them see those videos. She starts giving them the anticipation of the very fact that, see, it is not a painless thing. Absolutely. We start telling them that we have this facility. The medical science has advanced so much that painless labor does exist. If you opt for epidural analgesia during labor, we let them know what are the warning signs and symptoms. Because once they are in 34 weeks, post that they might land up in labor anytime. So, what they need to do, there is a checklist. We let them know, first thing, do not panic. Second thing, do not call us. Come down straight to the hospital, because telephonically might be you are not able to convey, or we are not able to understand. The files are not in front of us. We wouldn't be able to recollect each and every patient who comes down to us and all the records of the patient. So come down to the hospital. Hospitals, especially who are practicing obstetrics, are open 24 by 7, and they do have doctors over there. So that's the second thing. Do not call, come to the hospital. Third thing, which we specifically tell our patients, that when we leave, दर्द आने चालू हो गए तो घर के बड़े या हम खुद भी सोचते हैं कि चलो वहां जाके तो खाने को मिलेगा, नहीं मिलेगा तो यहाँ से थोड़ा खा के चले जाते हैं. Never do that. Never ever do that. You can have a small box of, cookies or biscuits along with you. You go to your gynac. Let her check you first. Let her do your examination. Let her hear your fetal heart sound. That is the heartbeat of the baby. Let her do an internal checkup. Let her see that everything is fine, because many a times it's an emergency and you've already consumed something. So anesthesia becomes a problem. So that shouldn't be the case. So you should go to the hospital, be calm, be composed. You should know about the warning signs and symptoms that when you need to go to the hospital. So very importantly, whenever you are feeling that the fetal movements have decreased than what they were, yes, definitely what you were experiencing in the later second trimester, the end of third trimester, it would be less, because the space for the baby to move around is a little less. It has already grown up, the size of the uterus has increased, but 3 to 4 movements in 1 hour after you've consumed food is normal, because the baby also sleeps. So, not all the time the baby would be moving around. So, if you are experiencing any decrease in the fetal movements, or if you've had any gush of water, which we say the water has broken, my water just broke, that is what we hear. So, yes, if your amniotic membranes have ruptured, to be very scientific, you need to go to the hospital. If you start experiencing pain, which is increasing in intensity and duration, and has been accompanied with some mucoid discharge or a bloody discharge, or if at all, the blood pressure is increased, or if at all the patient is already, hypertensive, if she starts having headache or epigastric pain or nausea, vomiting, giddiness. So these are the warning symptoms which we do tell our patients that if any of this happens, they need to come down to the hospital. Other than that, there is one more checklist, which we tell them, okay, now you're 34 weeks, so you get a bag and keep all these things, which includes, having a loose gown, which includes a set of sanitary napkins, which includes some newborn clothing, all these things. So keep it ready, so that when you have to go, all you need to do is just pick up that bag and leave for the hospital. So these things should be done. And other than that, complete blood count, which is important, and make sure that you carry your file when you're going to the hospital, because it's very important. It would be having the entire pregnancy records for the doctor to, know if at all something specific for you has to be taken care of or not. So I think these are the things which are very important. Breast preparation, as ma'am has very rightly already mentioned, that yes, the breast preparation is important. uh, Counseling about the labor, how labor is, how a painless labor can be opted for. And I think many women these days are opting for cesarean section on demand. So I think we should respect that fact also. We should counsel them that, see, this is what it is. You should give them pros and cons of both, and that is how, we should be going ahead. So these are the things which are to be taken care of. And other than that, one important thing is this, that the father, yes, mother should be prepared for all these things. Yes, the father and the family should also be equally prepared to deal with the fact that they have to, you know, encourage the mother during labor. They have to be very supportive. They have to, give the fact that they have to respect her decision at any point of time. They have to make sure that once the baby would be delivered, they have also to be, prepared for bringing a new life into their house. So they have to be supportive of the mother. So all these emotional and, psychological aspects should also be taken care of, that they would be heading towards another responsibility, so they should be taking care. And one thing which we have added to is that the financial management should also be, a little bit of counseling should also be given on that, when it is the 34 weeks, that how they should be taking care of their finances once the baby has, arrived, because there would be a lot of added on expenditure. So these things should be taken care of when it is birth preparedness for the mother and the family as a whole.
Very, very nicely put, Dr. Parul. Very, very nicely put. And now to go ahead, now just as the baby is born, okay, we have a question. What can men do, considering they might have a day job and can be unavailable at home for 8+ hours, to make a pregnant lady's, be it wife or sister or a friend, life at home better or easier?
What they can do is that wherever they are working, they can take breaks in intermittently. Every 2 to 3 hours, they can have or grab a snack. They can just stretch out their arms. Many IT companies and all, they have another room where they can, just stretch out a little bit. Or if the room is not available, they can just get up, be on their toes, just, do a little bit of stretching with their arms, take a break for 10 to 15 minutes, take a stroll, and then I think that should be done. And considering if everything is okay, pregnancy is not a disease. One thing should be taken care of. It is a physiological process. Unless and until it is something which has, added on high risk factors in the pregnancy, I feel pregnancy should be as much as what a normal woman is doing. All these small considerations should be taken care of, and I think she's good to go. And she can lead a normal life.
Okay. Dr. Anjali, would you like to add on to this? What can men do?
Yeah, the question was what can men do? So the question
Okay, I
about
did
it.
not see what can men do. I thought what can they do at the things.
No, no, it's
Yeah.
okay. So what they can do is they can intermittently, frequently call their wife, call their friends, and see whether she's okay, her mood is good or not. Order her something for which she's craving to eat, because we all know that pregnant women have a very different kind of choices for what they want to eat. So they can make their absence felt by sending her some lovely flowers, some small gifts, something to eat, what she likes. And if not, be there physically, be there virtually with her, be there virtually with her, and convince her that at a tip of a what to say, ishara or gesture, they will be available. Whatever meeting they are into, whatever emergency work or urgent work they are into, we leave everything aside and be there for her. So, if this much faith can be given by men to their wife, to their sister, or to their friend, ki any thing they need, they will always be there on their toes. I think that that is enough to have a stress free period for the pregnant lady, and I think she would be happy. And then when you are home, give her quality time, be there physically with her, be there emotionally with her. And these are some of the moments where I think where whatever she demands can be fulfilled, obviously within the range of sanity, not going out of sanity. So I think that is how the men can be protective and supportive to their wife. That is the way they can be, even if they are working. Or in today's era, they can take work from home. So even that can be done. So even if they are working for 8 to 10 hours, at least their physical presence would be there, which can be felt by the wife.
And also,
Surabhi?
post-pregnancy, post-delivery, paternity leaves are also available these days. So
Yes,
that can
they can
also be
avail
taken.
those.
They can avail
Yes.
those. Yes, you were
Just to
saying
add on
something.
one thing,
Yeah.
yeah, what we do is many a times, these women, they come over and they say मेरी नींद ही नहीं हुई है या फिर मेरे को नींद नहीं आ रही. They, during pregnancy and especially the later phases, they get a lot of edema in the feet, or they start getting those cramps, which you might call, and they have this back pain and everything. So what we tell them is they usually, the husband and wife, accompany, the husbands accompany their wives. So what we say कि आप एक काम कर सकते हैं, the supplements and everything what we are giving, yes, that's one thing, but कभी कभी आप husband को भी बोल सकते हैं कि आपका पैर दबा दें, तो they will feel, you will feel good with that. So the husbands, they, immediately they say हम वो तो हम कर ही रहे हैं. So I think as it is, the society has changed a lot. The men have become very supportive of their
Yes,
wives
yes.
in all these things. So this is also one thing, that giving them a light massage or just talking to them through whatever they have been through. Because see, saying this, that this is normal, yes, it is normal, but the one who is experiencing it, it is a little troublesome. So we need to empathize with them. So I think that is what men can do. They can show at least that they're empathetic towards their wife, uh, you know by all the things which
Yes.
ma'am has also mentioned. So empathy is one factor which is, I think, very important for them.
I think empathy goes a long way here,
Yeah.
specifically.
I can tell by
Also,
my own experience that I was not working when I was pregnant. And being a gynecologist and being on toes all the time, every time. And my husband, he started, just gotten into practice and, running from pillar to post, from this end to that end of Nagpur. So no time and all those things. I was just going crazy, yaar, ki matlab no time, and look at me, I am at home. So once he used to come back home, and if he used to give me 10 minutes and talk to me, it's okay, it's just this phase, and then you see your career would be at a boost and we'll have a baby and all those things. It gives
hmm,
you, that pump. Yes, we are doing it for ourselves. Otherwise you
yeah.
get that feeling कि ये मैं अपने लिए कर रही हूँ क्या, ऐसा क्यों. So I think those 10 minutes, as ma'am very rightly mentioned, that quality time. So it's not the measure of amount of time, quantity is not the thing which would actually make a big difference. It's the quality of time. If you give them right, I think they are good to go.
Yeah. And even I've seen like a lot of fathers nowadays, they go home and they speak to the baby as well, just as the mothers do.
Yeah, yeah, yes,
They
yes,
sit
yes.
sit with the wife and they touch their
So that
belly and they
is, or
start talking.
that is
A part
stimulation.
of
That
that
is sensory
sanskar.
stimulation.
Good. Yes.
Yeah.
So now, Dr. Anjali, your role comes in. Now we have done the delivery. Okay. So now the child is handed to you as a pediatrician. So what
No,
all? Okay, no.
the child will not be handed to me. That is the change now. The child will
Yes,
be
To
delivered
the
over the
mother.
mother's
to the
abdomen.
mother. Yeah,
Yes.
Yeah,
yeah,
so the
yeah.
child will be with the mother. The baby will be with the mother, not with me.
No, but immediately for the checkup, the
Immediately,
pediatric
the
checkup.
mother, the baby
Yes,
on her
yes,
breast,
everything
on
has.
her.
If the
Okay, so
baby is
this.
crying
Yes.
normally, if the baby is vigorous, if the baby is crying normally, everything has to be done on the mother's abdomen nowadays. The
Oh,
pediatrician would cut the cord, dry the baby, initiate breastfeeding, everything on the mother's abdomen.
oh, wow. A
Yeah.
good change.
So that's a big change which has come now, that the deliveries are, whether it's a Caesar or a normal delivery, the baby has to be on the mother's abdomen. And once the pediatrician comes in to attend the delivery, he has to ask the obstetrician regarding cord management as well. That is also something new which has come up, is that earlier we used to immediately cut the cord and separate the baby from the mother. Nowadays there is a concept of delayed cord clamping, and this is because we want all the blood which is there in the placenta to flow into the baby so that the baby gets maximum amount of immunoglobulins and the other protective factors which are there in the placenta and the cord um, during pregnancy. So we need to also know what is the cord management. So if the baby is vigorous, if the baby is crying well, so we'll cut the cord 30 to 60 seconds later. But if the baby is not crying, if the baby is not vigorous and needs immediate attention by the pediatrician, then we tell the mother, हम बच्चे की नाड़ काट रहे हैं और बच्चे को लेके जा रहे हैं थोड़ी देर के लिए, बच्चा रोया नहीं है, उसको ठीक करके तुरंत हम आपके पास बच्चे को वापस लेकर आएंगे. So this is something new which has come, that the baby has to be on the mother's abdomen till initiation of the breastfeeding.
All right. Okay. So now coming to that, breastfeeding. What are the advices that you give for appropriate breastfeeding?
The question is to me?
Yeah, to both of you actually, but because both of you advise for breastfeeding.
Yeah. So first and foremost, as I told you, the antenatal counseling is very important for the mother to get her prepared for the breast and the breastfeeding. Though, it's not a very pleasurable experience because the mother already has gone through so much of pain during pregnancy, whether it is a normal labor or whether it is a cesarean section. So she needs to be told that she has to initiate the breastfeeding. Nowadays, we say within an hour of birth or within half an hour of birth. So for that moment, the mother can't sit down. So proper positioning, what we say, that the back has to be straight, the back has to be supported, the baby has to be kept under a pillow and very close to the breast. All those things can't be achieved within an hour of birth. So the best position that time is the lying down position. And if the mother is cannot take a side position, somebody needs to assist her with the baby on her abdomen and head in between the chest, between the two breasts on the chest, and initiate the breastfeeding. I would request all the would-be parents to go on YouTube and search for breast crawl. It's a wonderful video where it shows that nothing needs to be done. The baby finds its food by itself. So you just leave the baby on the mother's abdomen, and within half I think am I audible?
Yes, yes.
Surabhi, am I audible? So that needs to be done, and you will see how nicely the baby crawls and goes up to the breast and starts sucking at the breast. So initiation of the breastfeeding, temperature maintenance, very important, drying of the baby and keeping the baby close to the mother so that mother's warmth, mother's skin to skin contact will keep the baby warm. So these are the two things, and looking at the pattern of breathing of the baby is very important, which again, when the baby is kept with the mother's chest close to her, she can feel the breathing of the baby and she can identify whether something is wrong or not. So all these things need to be looked after immediately after birth. Dr. Parul can elaborate more on this.
Yeah. So ma'am has very rightly told all the positions also, that what all positions should be, advised. Whenever we are taking rounds or whenever the baby has been delivered normally or through cesarean section, as ma'am has told, that yes, this is the new thing which we have started practicing, that is the delayed cord clamping and the baby handed over to the mother as in on her abdomen. Yes, these are the two things which we are doing. Other than that, we always, make sure whenever it is the breast feeding which we are talking about, we tell them it is exclusive breast feeding, because and no prelactals, because still we see this in and out, that still that prelactals, those things are still prevalent in the society. So we let them know ki no prelactals, no honey, no good, no, I mean there are numerous amount of things which people would want to do, but gutti jise kehte hain, so none of these things are to be practiced. It's only the mother's milk and mother's milk which you have to take care of, and it has to be exclusive breastfeeding. Other than that, we let them know ki whenever every 2 hours you have to make sure that you breastfeed the baby. You have to tap on their feet, make sure that they're awake, and if not awake, they're suckling pretty well. Make sure that the entire nipple and the areola goes inside, because if it's just the nipple which is going inside the baby's mouth, if the only nipple has been suckled, then the females, they start having those cracked nipples and difficulty. So that is very important. If at all the women's breasts were not prepared, and if she has retracted nipples or any of these things, so the breasts should be examined, and we should counsel that you have to express out the milk. You have to make sure that you express out the milk, and you feed the baby with katori and chammach, no nipples, no artificial bottles, nothing of those sorts. And the expressing of the milk can be done through it can be done manually or breast pump, any of the two things. And exclusive breastfeeding is very important. They shouldn't be allowed to use the lactogen or the powders which are available in the market, I suppose, because once the baby get used to with the katori chammach or the easier way out, they won't suckle. And this is a cycle. So if it would take time, especially in cesarean sections. It takes time for the breast milk to be expressed out the way and the quantity which is required. But we have to be patient. We have to counsel them. We have to make sure that we counsel the people around them that it's only the breastfeeding which is very important, especially the initial breast milk, which is called as colostrum, is very important. It is rich of so many immunoglobulins which are like a boon. जिसे कहते हैं ना जन्म there's a term to
Amrit.
it. Amrit, yes, you can say Amrit to the baby. That should be the key. We should make sure that that is how it should be. And especially it's a two-way thing. The gynecologists and the pediatricians, the two of us, have to be very very staunch on the fact that we tell them that yes, it's only exclusive breastfeeding which you should be taking care of, rather than just being a little eased out ki haan chalo theek hai. You should be very supportive, but at the same time you should be affirmative that you should be doing breastfeeding.
Right. So motherhood doesn't stop here at breastfeeding or just the child is born and after 6 months it's done. So I think pediatricians then play a major role in that later on when the child starts growing and the mother and children come to them. So what happens then? From there onwards to adolescence. Like how do you advise safe motherhood from there onwards to adolescence and also see the mental health or the physical health of the child?
Uh, Physical health is, I mean, obviously the nutrition which plays a role. So I will not be much talking about the physical health,
Yeah.
but very important today, what I feel is the mental health, which needs to be taken care of by the parents to see that their child, their uh, the siblings together in a family grow healthy mentally, not physically. Physically, every parent takes care of the nutrition. I know that they go to the pediatrician where monthly the weight, the height, and everything is checked, and they are being counseled regarding the nutrition. But what is left behind is the mental health, which is creating a chaos today, which is creating a ruckus today when they grow up as an adolescent. The
Yeah,
rage
a lot
which
of
we
them then
see,
develop personality disorders.
yes, the rage which we see today in the adolescents, and not only the adolescent, I should say, even in the school going age group, children like from age 9 and 10-year old child also. And
True.
all courtesy, I think, is to the smartphones which they have, the Google, the Chrome, everything is internet facility which they have, everything at the tip of their fingertips. They have it. And so we need to counsel them regarding all these things, and whatever may be the answer to that question, whether it is odd on their part to talk about it to them at this age or not, should not be thought, but the right answer needs to be given to the children. It's not something कि you try to dodge them from the right answer, saying कि बाद में बता देंगे, अभी आप छोटे हो, अभी आप नहीं समझ पाओगे. No, nowadays children don't accept such answers. You have to tell them what they are asking, and you have to explain the reason behind it, the scientific reason or the non-scientific or the mythological reason, or whatever reason you want to explain the answer to the questions. And as I told you, sensory stimulation does not end in the newborn period. The sensory stimulation has to go on lifelong. So it is the good teachings, the good readings, the good viewing, the good eating, and the good smelling. All these things together, when happens by both the parents and the family, if it's a joint family, then only you can expect a child to grow up mentally normal. Because any conflicts in the opinions of the parents or the grandparents, like, I think the rearing up of the children should be left up on the parents. The grandparents should only be bothered about loving and nurturing the grandchildren, so that the grandchildren have only good vibes about the grandparents. They should know that हम आज अपने नाना नानी या दादा दादी के पास जाके पूछे तो हमें मना नहीं होगा. अगर हमारी ये गलत है, डिमांड गलत है, तो वो हमें समझा देंगे, लेकिन ना वो हमें डांटेंगे, ना वो हमें मारेंगे, और जो चीज हम चाहते हैं वो चीज वो हमारे लिए कर लेंगे. तो the bad part needs to be taken up by the parents. The restrictions, the rules, the discipline, all these things are to be taken up by the parents, not the grandparents. But the grandparents should be in synchrony with the parents. Like the rules laid down by the parents should be followed, though subtly, by
Such a
the
good advice.
grandparents.
Yeah.
Same applies for mother and father. If the mother says something, the father has to accept that and not give away to the child. कि जान दो, मम्मी नहीं बोल रही है ना, मैं दे दूंगी. Same thing, if the father says no, the mother should not oppose it, saying करके कि नहीं बेटा पापा तो डांटते रहते हैं, आ जाओ मैं आपके लिए कर दूंगी ये चीज. So this difference should never be there, where the child knows कि अगर एक ने हमको मना किया, so I can get my demand fulfilled by some other person in some other way. So this harmony in the family amongst the parents and amongst the grandparents, if they stay together, has to be maintained for a normal mental environment and growing up of a child, to come up as a good person, a good human in the family and in the society, which is very important in today's life.
Such a beautiful advice, actually. It was very wonderful to listen to that. Okay, Shruti Deshmukh is asking, are there any warning signs of HELP syndrome?
See, HELP syndrome basically is for the patients who are having raised blood pressure, that is preeclampsia. That is one thing where they develop HELP syndrome. So, warning signs are the same as what are there for severe preeclampsia, that is headache, that is epigastric pain, that is giddiness, that is vomiting. These are the things. Other than that, yes, they are supposed to get a parameters which are to be tested, that is complete blood count, the liver function test, the kidney function test, the coagulation profile. The patient might develop petechiae, or she might have oozing or bleeding from various orifices, so that should be taken care of. And HELP syndrome in itself, it is elevated liver enzymes and low platelet count and hemoconcentration. That is what it elaborates to. So these parameters, if you get them checked, and your blood pressure. So when all these things are taken care of, the most common reason or the cause for HELP syndrome is preeclampsia, that is raised blood pressure during pregnancy. So I think if these prodromal symptoms are there, and if these warning signs are there, and these tests, if they have been done, and if the values are deranged, yes, the patient is warranted to urgently rush to the hospital.
Okay. So I think we have almost हाँ ये क्वेश्चन मेरे सोशल मीडिया पे भी आया एक्चुअली कि ये वाला नेक्स्ट पूछना करके. Okay. So what about motherhood in cases of surrogacy or adoption? Despite biologically not conceiving a baby, how can a woman become ready to become a better mother?
First of all, a very wonderful question, especially in today's era where surrogacy and everything has been taken up with a lot of women, and adoption also, because the cases of infertility are increasing. So there have been studies which say that, in spite of the fact there is surrogacy and adoptions have been there, once the baby starts staying with you, they start developing the factors and the characteristics of the parents whom they actually stay with, rather than the biological parents. So a woman should become ready to become a better mother by undergoing all these things of being patient, of, um, when it is surrogacy, they have to have that acceptance that this is their baby. Might be, they have, like in surrogacy, the eggs and everything are theirs, but all these things are in the other women's womb. So you should nurture that woman. You should, the garb sanskar which we are talking about, you can talk to your baby in her womb. You should be so feeling so fortunate about the fact that another woman is carrying your baby and is going to give you the joy of being a mother. And when it is adoption, yes, it is a very tedious and a cumbersome procedure. It takes years altogether. But a mother and a father, as they're preparing for the pregnancy and, a motherhood and a career with a baby, they should be planning all these things when it comes to, being parent to a child. All these things which ma'am has mentioned, that the family harmony is very important. So all these things can be done. And in surrogacy, we have been doing surrogacy at our hospital. So this is very important, that the surrogate, the mother who is carrying the baby, the surrogate mother, which we can call that to be, we can connect with our baby in her womb through Garbh Sanskar, taking care of that mother, making sure that she eats healthy, making sure that we recite all the, good things to her, good poems, good hymns, Gita, all those things. So probably we can do that for our baby through her in this way. I think that would be really a sight, and we see that. We've had 3 surrogate mothers in the past 1 year, and it is amazing how the actual mother, helps the surrogate mother to start learning, A, B, C, D, because there is a little bit of disparity in the educational strata and everything. So you can actually, get involved with that mother, that surrogate, so that at the time and the things which she is thinking of, the things which she is eating, is all healthy, and your baby is in an absolute healthy environment around you.
I think that was a wonderful answer, and also Anjali ma'am would really want to pitch into this.
No, I would just like to say it's the family preparation mentally, physically, and in all sense, financially, that needs to be done much before you plan for surrogacy or you plan for adoption. So, unless and until you are 100% mentally prepared as partners, as family, and for rearing up your the baby who's going to come and enlighten your lives financially as well, I think don't ever get into surrogacy or adoption. to get into it only after you are completely prepared for this new member in the family.
Yeah, financially, educationally, psychologically, in every sense.
Yes.
All right. So, okay. Recent years, many young mothers are affected with breast cancer. What are the main reasons? Some people say that non-breastfeeding is a main reason for breast cancer. Is it correct or a myth?
It is not 100% correct, but we say that the women who have breastfed, they have reduced chances of developing breast cancer eventually. But this is not
A
the
causative factor.
reason, matlab, the sole reason for somebody to develop breast cancer.
Yeah,
But yes, if a mother has, if a woman has breastfed, so her chances to develop breast cancer definitely reduces. But if she has not, I don't think that, that would be one of the contributing factors for her to definitely develop breast cancer.
true. So I think we have ended on a wonderful note, and we have already exceeded our time because of the demand of this topic and the way you two intellectually answered. So yeah, it was really wonderful. I'll just wait for Anjali ma'am to come back, but I'll still by the time talk to you. So it was really wonderful having you on board and listening to both of your inputs. And you two answered all the questions so beautifully and wonderfully and so intellectually that I was enlightened on many things myself, being a doctor.
Our pleasure, Surbhi. Matlab, it was so wonderful to share the same platform as Anjali ma'am and you having to, have such an interactive and such a important topic, which is socially very important, where we could, give inputs that people should plan pregnancies earlier, preconceptionally pregnancy, because, women, they contribute to one of the major aspects of any fundamentally anything, be it a family, be it a house, be it the nation, be it the entire world, be it the mother earth, everywhere it's the women. So I think pregnancy was a very important topic, and I'm so glad that this time I could make it for your show. It is
Yeah,
absolutely a pleasure. Thank you so much.
Same here, Purvi. Surbi, like I
you
really
mixed our names.
exactly. I always enjoy being on your show. It is such a interactive, wonderful show, and the questions are
Thank you.
so nice. And you really feel nice answering all those questions. They are wonderful. I love
Thank
coming on your
you.
show.
Thank
Thank
you.
you
Thank
so
you
much
so
for
much.
inviting me. And it
And both
was
of you
great
amazing
meeting
doctor.
Parul. And
Thank you, ma'am.
I hope we continue to meet somewhere again.
Yeah, I
Absolutely,
think
ma'am.
in person
Absolutely.
we can plan something together
Yeah,
also.
Yes,
surely,
yes.
surely. I would love to meet her in person.
Same here, ma'am. Very mutual.
And I think both of you amazing doctors should definitely try out our app and give us some time for giving you the demo. Maybe you'll like it and
Sure,
you can just be on it.
Sure.
sure,
Thank
sure.
you so much and good night. So at Everox Healthcare, we actually think more about whatever topics you want to be talked about, whatever you want us to cover. So do comment on whichever topic you would want to be covered next. As you know, we always covered most of the sensitive topics which are not talked about more clearly. Also, please like, subscribe, and comment anytime, and contact us on our helpline number, which is already available on the poster whenever you need help. Thank you and good night.